Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombiewski, nurse practitioner here at RevitalyzeMD.
So this is going to be a fun podcast because it's one of our favorites as an office. I mean, who couldn't love it? But it's a non-surgical BBL or a
Brazilian butt lift.
Yeah, it's awesome. So where you can use filler to get the same or nearly the same results that you would with the downtime of a Brazilian butt lift. And I don't know if anyone
with no
knows.
downtime.
Yeah.
Minimal. Yes, I'm like, not the downtime of surgery, girl.
Yeah, with no downtime. Yes, no, that
or very minimal. I had some bruising, but that's not a big deal. It goes away.
Yeah, no, really, you get minimal downtime. You get no downtime. You just get minimal effects of it acutely.
Absolutely.
So, and if you guys have ever looked at the surgical downtime of a BBL, it's ridiculous. So you're talking about almost 8 weeks of kind of downtime with that. Like, again, you're talking about a few weeks of it's your butt. You sit on your butt on a daily basis.
Yes.
Like, you cannot sit. You have to lay certain ways. You know, it is a significant downtime and cost. And so, that's something you seriously want to consider before you would ever undergo a surgical procedure. And that's why I think a lot of people don't end up having them.
So what exactly is a non-surgical Brazilian butt lift? What product did we use? What does that look like? And I'll turn that over to you.
Well, so basically in aesthetics, we've used a lot of what we call HA fillers, so hyaluronic acid fillers. And so that's your typical filler. So you hear a lot about that. So that would be, again, everybody's heard of Juvederm, but if you've heard of Restylane Kiss, Bellatero, those are all HAs. Most are HAs. There's some permanent fillers on the market. We don't use them in our office. So, but what we're talking about is biostimulatory fillers. And so those basically fall into two main categories. And one is Sculptra and the other is Radiesse when we're talking brand names. And Sculptra is PLLA. And then Radiesse is calcium hydroxyapatite crystals. So essentially what we're talking about is filler that gives you a fill, at least with the Radiesse. Yeah. And then it's going to stimulate your body to produce collagen elastin. And that's what a biostimulatory filler is. So what does this do? And what's the difference between the two? Just in short, PLLA or Sculptra is not going to give you fill initially. It is going to produce collagen elastin over time, but you're going to inject a lot of product that dissipates and then does work its magic over time, but you get no effects immediately from that, not after the fluid dissipates. What is the other issue that I think is significant with
the patient has to do some work.
They got to work. If we're dependent on the patient to do the work,
you got to do a lot of work. You're going to have lumps and you're going to have nodules, and it is up to the patient to really work those out at home.
Yeah.
And that never really goes 100%. If we can't have you walking out of the office in the exact way we want you to be.
Yeah. Well, if you got to walk out of the office and do work, then I view that as not successful, because then it's dependent on you doing something. So if there isn't the effect that you want, or there's an adverse effect, was it the injection? Was it that we didn't do the work after? So again, we don't want to require our patients to do work after. And so massaging yourself, 5 or 10 minutes a day, 5 times a day for a couple weeks is just not really ideal. It's not ideal.
Being aggressive in that rubbing, and everybody's view on what aggressive is very different.
Yes. And so the risk of nodules and nodularity is pretty high with Sculptra because of that, because it's dependent on you doing something to your treatment area after you leave.
Yes.
Where Radiesse is a biostimulatory filler as well, with lots of studies that will show it produces collagen and elastin over time. And elastin is huge as well. And again, it's a calcium hydroxy. It's basically calcium crystals. And we're using those calcium crystals not only to fill, and it's got a substance in the filler that we don't have to dilute it at all. We can put it in cheeks and jaw. We can put it in all kinds of places, or we can dilute it just to get skin tightening, or we can get a fill, which is what we're looking for in the butt, and all the positive skin effects as well.
So we are taking it and we are diluting it down with saline and lidocaine to make it spread further. Plus, like Dr. Durst said, it can help with texture. It can help with breaking up cellulite. It can help with filling so we can get volume and lift, as well as those textural changes.
And you're going to get that in the office. So you're essentially, you don't have to do work after you leave. And this filler actually will give you fill initially. We are purposely diluting it to get the additional collagen and elastin effects. And so you get the fill, you get the volume, but then you get all the positive skin changes that go along with it. And again, there is a lot of, diluting it purposely. So there'll be some dissipation of that fluid. But a lot of times in the butt lifts, it actually stays. And because we're putting such a large volume in. And so people are pretty happy with the results immediately. And then long term, it's just continuing to build and stimulate collagen elastin.
So what does it help with? So we've kind of touched on this a little bit. It's helping with cellulite. It's helping with lift. It can help with shaping the buttocks, giving them more heart shape, giving them more of a shelf up top, volume all over, but it can also help with hip dips. So that is something I've never really seen in practice before to resolve hip dips. And you can fill that depression, that divot, that void very well with this treatment and give a more natural contouring look.
And so again, what are hip dips? So as we work out, some women just develop these, like the one muscle might be more formed than the other. So they get these little indentations on the side.
Where the body almost kind of concaves in on the side.
And so your butt, instead of going like this, is going in, and there's an indentation on each side. Some can be mild, some can be pretty pronounced. And most of these ladies, again, are in great shape. So they're in great shape, but it's just the way that their one muscle might be forming versus another. And there's probably some ways that you can fix that in the fitness world. But again, once it's there, it's pretty hard to fix that isolate, and you can do that. And again, you can provide more of a shelf below. You can provide a lift above. You can do all of the volumizing. And again, that little, kind of where you're going out, you're just getting a great contour and rounding of the buttocks, period. So it's a beautiful treatment.
And some people love their hip dips. If you love your hip dips, that is amazing. But a lot of times, even with that, like Dr. said, it's very easy for us to build a little bit more on one side than the other. So it may even be just rounding out where that muscle is, where you've got more volume on one side, or maybe a little bit more lift on one side than the other. We all have a dominant side.
Yeah. Well, and we also want to know whether that's something that bothers you or not, because we're not going to address the hip dips if that's not something that's bothering you. So during a consultation, we find out what you want to see improvement in. And we definitely always address the hip dips if we think they're present, just to make sure that is or is not something we're addressing during the treatment. You know, how long does it last? So like if you look at biostimulatory fillers, in general, we always say 3 weeks to 3 months is when you're building, like you're regenerating. But with this filler, you know, again, it's stimulating the fibroblasts to release collagen and elastin. And if you have something that's not really communicating with the fibroblasts, they're sitting there just not functioning. And so once you get them functioning, you know, again, you can have prolonged effects once the collagen elastin is formed. So we're talking about, 18 months, 2 years, where the collagen that is formed is lasting. But again, we're aging still. So keep that in mind. Everyone's different. Absolutely. How they respond is different, and we're still aging. So as we're aging, we're not going to get that continued duration of collagen's not going to last as long. So those are things just to keep in mind, but it's a pretty significant treatment time because it's stimulated your body to do something. And now that collagen elastin that produced does last as long as we're taking care of ourselves, working out, doing the right things, staying hydrated, nutrition, all that.
So I think that's good. So who's the ideal candidate? So someone who is at or pretty close to their ideal body weight. We want to be realistic with our patients. This is not butt implants. So if you're looking for a butt implant, this is not going to be that treatment. No. If you're looking to get a bigger butt, but you don't have enough fat for a fat transfer, this is a great option to give that volume. If you are wanting that lift and that volume, but you're not wanting that surgery in the downtime, again, this is another great option. So you're going to leave the office with volume. You're going to see results that just improve with time.
And again, this is one of those treatments where you're going to see the effects immediately. And then you're going to have long lasting, improvement and be happy with the results. So, and again, we'll figure out, what you want. And if you're a right candidate, once we see you in the office and we talk about things. But, the surgical downtime with a Brazilian butt lift is significant. And some people want something. And again, as we age, we kind of lose our butt structure. And cellulite. We didn't even talk about that because cellulite's a hard thing in the butt to treat. You can actually kind of subsize too, even when you're doing the treatment, where you're actually kind of breaking through cellulite, but then it's going to fill in those little dips, cellulitic dips.
Those little dimples.
Yeah.
So it's go a great in way. And fill and break up that tissue and really see those texture changes, which is amazing.
Yeah. And you don't want to kill fat in the butt.
No.
So you don't want to kill fat in the butt. And this is one way where you can actually augment the butt, but you can't get rid of cellulite any other way. Like you basically are looking at subcision or, injecting a biostimulatory filler to actually, again, improve those dimples from cellulite without killing fat.
Or using radiofrequency. But again, we don't want to necessarily do that in the buttocks because you want that fat. You just want it to look pretty.
Yeah. Yeah. So you can get some skin tightening with certain treatments. It's very hard to do and to get into the surface. And again, we do have a treatment, Vitona, that does some skin tightening, doesn't kill fat. You can separate the two out. But again, even if you're doing that, this is one way where you can get the volume, you can get the butt you wanted with non-surgical options, and you can get rid of cellulite. You can increase your tone and texture looks better. Amazing treatment.
So what about downtime? So you may be a little bit sore, you may have a little bit of bruising, but again, nothing compared to what you would have with surgery.
Yeah, and it's going to go away. It will go away.
The swelling, the bruising, the soreness, it goes away pretty quickly.
Even nodularities, because we use Radiesse with ours. And so if you notice something initially, it's usually because we're placing it. And again, you're going to have some, nodules or lumps or bumps, but it all goes away, 24, 48 hours, and that goes away. And you don't get those side effects with diluted Radiesse like you do with Sculptra. So again, getting the right providers, the right services, learning more about it all the time. I love looking at other providers, how they do it and the results they're getting. And then we can come back and just fine tune and perfect ours. So if you want to learn more, definitely reach out to us in the office. And if you have any experience with a Brazilian butt lift, you want to talk about downtime or the effects, or if you want to talk more about an experience you've had with a non-surgical option, we would love to hear more about it. Like, subscribe, share with friends, because this is an amazing treatment. You can come into town and get it done, get a bunch of other stuff done, have a little girls trip, all that.
Absolutely. And you can always check out our website. We have a page on the BBL.
Yeah, absolutely. So again, like, subscribe, share, and let us know if you want to hear anything else specific, as we're willing to deep dive into anything aesthetics and wellness.